What if I told you the real source of that nagging, aching pain in your knee isn't your knee at all? If you've ever felt that familiar twinge when you stand up from a chair, that grinding sensation when you climb the stairs, or that deep ache that keeps you from enjoying a long walk or playing with your grandchildren, then I want you to listen very closely. Because for millions of Americans, the search for knee pain relief is a frustrating journey. You've probably tried the braces, the creams, the pills, and maybe you've even been told, well, that's just a part of getting older. I'm here today to respectfully, and with the backing of a growing body of evidence, challenge that idea completely. We're going to talk about a hidden culprit, a major player in your body's mechanics that is often overlooked in the conversation about knee pain. And by the end of this video, you will not only understand this connection, but you will have a simple 30-second test you can do at home to see if this might be the key to unlocking lasting relief for you. Now, I know what some of you might be thinking. You've seen the flashy ads and the miracle cure videos before. I get it. The world is full of promises that don't deliver. That's why this is not going to be one of those videos. My goal today is to act as your knowledge broker. I've spent countless hours digging through the research from respected institutions like the Mayo Clinic, the Cleveland Clinic, and the American Academy of Orthopedic Surgeons to bring you a logical, evidence-based explanation for your pain. We are going to treat this like a fascinating investigation. First, we'll address the skepticism head-on and reframe that promise in the title. Second, we'll dive deep into the why, the simple biomechanics of how a problem in your hip can directly cause pain in your knee. It's a concept that physical therapists see every single day. Third, I'll guide you through that 30-second self-assessment to see if this connection applies to you. After that, we'll cover 3 foundational, safe exercises to begin addressing the root cause. And finally, we will talk about the importance of a holistic approach and debunk some of the most common and disempowering myths about knee pain. This is about giving you knowledge, not magic. It's about empowering you to understand your body better so you can take intelligent, effective action. And a quick but very important reminder, I am not a doctor, and this video is not a substitute for professional medical advice. The information we're sharing today is for educational purposes, to help you have a more informed conversation with your own healthcare provider. If you have severe pain, if your knee locks or gives way, or if you've had a recent injury, please see a doctor or a qualified physical therapist before starting any new program. Your safety is the #1 priority. So with that said, let's start with the elephant in the room. Let's talk about that promise of a 30-second hip fix. I chose that title to get your attention, but also to make a critical point. The real fix isn't a single magical movement you do once. The real fix is a shift in your understanding. It's the aha moment when you realize you might have been looking for a solution in the wrong place all along. The 30-second part isn't the cure, it's the clue. It's an assessment, a simple diagnostic tool that can point you in a new, more hopeful direction. Many of you, like a man I'll call Cautious Chris in our audience persona, are rightly skeptical. You've been down this road. You've tried things that didn't work. The last thing you need is another empty promise. So let's be crystal clear. What this video offers is not a miracle, but a method, a logical path to follow. It starts with understanding that your body operates as a connected system, what physical therapists call the kinetic chain. And when one link in that chain is weak, another link often ends up paying the price. For so many people, the knee is that link. It's the victim, not the culprit. Our goal today is to identify the real source of the trouble, which for a surprising number of people begins one joint higher, in the hip. This brings us to the core of our investigation, the why. Why on earth would a problem in your hip cause your knee to scream and protest? The answer lies in a beautiful and complex concept called the kinetic chain. Imagine an actual chain. If you pull on one end, every single link is affected, right? Your body works in much the same way. Your foot, your ankle, your knee, your hip, and your lower back are all interconnected links in this chain. As the American Academy of Orthopedic Surgeons often explains, movement and forces are transferred up and down this chain. Now, let's focus on the hip-knee connection. Your hip is designed to be a powerful, mobile, multi-directional joint. It's a classic ball and socket joint, meant to rotate, move forward, backward, and side to side. Your knee, on the other hand, is primarily a hinge joint. It's designed to do one thing really well: bend and straighten, like a door hinge. It has a little bit of rotation, but its main job is flexion and extension. Here's where the problem starts. There's a specific muscle on the side of your hip called the gluteus medius. You can think of it as the key stabilizing muscle for your entire leg. Its job is to keep your pelvis level when you're on one foot, which, by the way, happens with every single step you take. When this gluteus medius muscle is weak or isn't firing correctly, a cascade of problems begins. As you walk or stand on that leg, the weak muscle can't hold your pelvis stable, so your hip drops down on the opposite side. To compensate, your thigh bone, the femur, tends to rotate inward. Now, remember our kinetic chain? That inward rotation of the thigh bone travels down to the knee. But the knee isn't designed for that kind of twisting stress. It's a hinge. This inward collapse puts a tremendous strain on the inside of the knee joint, on the ligaments, and on the kneecap, forcing it to track improperly in its groove. It's like having a car with bad alignment. You can keep replacing the tires because they wear out on one side. But unless you fix the alignment, you're just treating a symptom. In this analogy, your knee is the tire, and the bad alignment is originating from the hip. Over thousands of steps each day, this subtle dysfunction adds up, creating inflammation, irritation, and eventually chronic pain. You feel it in your knee, but the problem-solving needs to happen at the hip. This is why so many people can stretch, ice, and brace their knee for years with little to no lasting relief. They're trying to fix the tire without ever checking the alignment. So how can you know if this is what's happening to you? This brings us to our 30-second assessment. And I want to emphasize that word again: assessment. This is a tool for gathering information about your own body. I want you to find a safe space next to a sturdy countertop or the back of a solid chair that you can hold on to for balance. Please, do not do this in the middle of a room if you feel at all unsteady. Safety first. All right, are you ready? Stand with your feet about hip-width apart, with your hand lightly on your support. Now, I want you to simply lift one foot off the ground as if you're going to stand on one leg. We're going to hold this for about 15 to 20 seconds. What I want you to pay attention to isn't how long you can balance. I want you to notice what happens at your hips and your standing knee the moment you lift your other foot. There are two key things to look for. First, did the hip of your lifted leg immediately drop down? You might even feel your torso wanting to lean heavily towards your standing leg to compensate. This is a classic sign of weakness in that stabilizing gluteus medius muscle on the standing leg side. It's unable to do its job of keeping your pelvis level. The second thing to watch for is your standing knee. Did it immediately want to buckle or dive inwards towards the midline of your body? If you look down, does your knee want to collapse in, so it's no longer tracking straight over your foot? This inward collapse is that dysfunctional pattern we just talked about, where the weak hip allows the thigh bone to rotate inward, putting stress on the knee. Now, slowly lower your foot and try the other side. Lift your other foot and hold, observing the same things. Is one side noticeably different from the other? Does your knee pain happen to be on the side that shows a bigger hip drop or a more pronounced knee dive? For many people, seeing this happen in their own body is a profound light bulb moment. According to the Mayo Clinic, a wide range of conditions, from hip labral tears to simple muscle weakness, can cause hip instability that refers pain elsewhere. This simple test helps you see that instability in action. It's your body giving you a clue. It's whispering, hey, the problem might not be here where you feel the pain, but up here where the control is supposed to be. If you noticed a significant hip drop or your knee caving in, it doesn't mean you're doomed. It means you've just discovered a powerful new place to focus your efforts. And that leads us perfectly to the next step. What do we do with this new information? If your assessment revealed some instability, the logical next step is to begin gently strengthening the muscles responsible for that stability. We're going to go over 3 foundational, safe, and incredibly effective exercises that you can start doing today. These aren't about heavy weights or intense workouts. They are about re-educating your muscles, teaching them to fire correctly again. As the experts at the Hospital for Special Surgery in New York often note, targeted therapeutic exercise is a cornerstone of managing hip and knee pain. Our focus is on precision and control. The first exercise is the undisputed king of gluteus medius activation, the clamshell. To do this, you'll lie on your side on the floor or a firm mattress. Bend your knees and stack them on top of each other with your feet together. Your hips should be stacked one directly on top of the other, not rolled forward or backward. Now, keeping your feet touching, you are going to slowly lift your top knee up towards the ceiling, like a clamshell opening. The key here is slowly. Do not rock your body back to get the knee higher. The movement should come purely from rotating your hip. The range of motion might be much smaller than you think, and that's perfectly okay. Lift until you feel the muscle on the side of your hip engage. Hold for a second, and then slowly lower it back down with control. The lowering phase is just as important as the lifting phase. Aim for about 10 to 15 repetitions on one side, focusing on quality over quantity, and then switch to the other side. Our second exercise is the glute bridge. This one is fantastic for strengthening your entire posterior chain, including the main gluteus maximus muscles, which also play a huge role in supporting your hips and back. Lie on your back with your knees bent and your feet flat on the floor, about hip-width apart. Your arms can be resting by your sides. To begin, squeeze your glute muscles, your butt muscles, and lift your hips off the floor until your body forms a straight line from your shoulders to your knees. Avoid arching your back. All the work should be done by your glutes. Hold this position at the top for 2 or 3 seconds, giving those glutes an extra squeeze, and then slowly lower your hips back down to the starting position. Again, control is everything. Don't just flop down. Imagine you're lowering your spine one vertebra at a time. Aim for 10 to 12 repetitions. Finally, we need to address the other side of the coin, mobility. Tight muscles can pull your joints out of alignment just as easily as weak muscles can. One of the most common culprits in our modern, chair-bound society is a tight hip flexor. A gentle kneeling hip flexor stretch is a great way to start. Kneel on a soft surface, like a yoga mat or a pillow. Step 1 foot forward so you're in a lunge position with your front knee bent at 90 degrees and your back knee on the floor. Keeping your back straight, gently shift your weight forward until you feel a light stretch in the front of the hip of your back leg. Do not push into pain. This should feel like a gentle opening. Hold the stretch for 30 seconds, breathing deeply, and then switch sides. Okay, let's just pause here for a moment and take a breath. We've covered a lot of ground, and it's important information. We started by acknowledging your well-earned skepticism about quick fixes. Then we uncovered the fascinating biomechanical reason why your hip is so often the real source of your knee pain, that kinetic chain reaction. You then became your own detective, using a simple 30-second assessment to look for clues in your own body. And just now, we've walked through 3 foundational exercises to start taking action. If any of this has been a light bulb moment for you, if you're finding this logical, step-by-step approach helpful, I would be so grateful if you just took a second to tap that like button below. It really helps the video reach more people just like you who are searching for trustworthy answers. Now, having these exercises in your toolkit is incredibly empowering, but it's crucial to place them in the right context. These exercises are a fantastic starting point, but they are just that, a start. True, lasting relief often requires a holistic approach, and it's vital to know when it's time to bring in a professional. Think of what we're doing here as gathering preliminary evidence. You've done your own investigation, and now you can go to your doctor or a physical therapist with much more specific information. You can say, "I've noticed my hip drops when I stand on one leg, and my knee tends to cave in. I've been trying these gentle strengthening exercises, and I want your guidance on the next steps." A physical therapist is a true expert in movement and biomechanics. They can perform a detailed assessment to pinpoint exactly which muscles are weak or tight, and design a program that is perfectly tailored to your body's specific needs. They can also check for other contributing factors from the ankle or lower back. According to the Cleveland Clinic, you should seek professional medical advice if your pain is sharp, sudden, and severe, if you can't put weight on your knee, if the joint locks or feels like it's going to give out, or if you see significant swelling and redness. These can be signs of a more serious structural issue that needs a proper diagnosis. But for that nagging, chronic, achy pain we've been discussing, using these exercises as a starting point to see if you can make a difference is often a very safe and effective strategy. It's about being proactive, not passive, in your own health journey. This proactive mindset is the perfect antidote to one of the most pervasive and damaging myths about knee pain: the idea that it's just an inevitable, non-negotiable part of getting older. So many of us have absorbed this message. We hear a creak, we feel a pang, and we tell ourselves, well, I'm just not as young as I used to be. And while it's true that conditions like osteoarthritis are more common as we age, a diagnosis of osteoarthritis is not a life sentence of pain and immobility. It simply means there's wear and tear in the joint, but the pain you experience is often dictated less by what an X-ray shows and more by the strength and function of the muscles surrounding that joint. Strong, well-functioning muscles act like shock absorbers, taking the load off the joint itself. This is why 2 people can have the exact same X-ray, and one is running marathons while the other can barely walk. The difference is in the support system. By focusing on strengthening your hips, you are fundamentally improving your knee's support system. It's also important to acknowledge a nuance here that builds trust. In the world of medical research, there's sometimes a gap between what physical therapists see working wonders in the clinic every single day and one has been proven in large-scale, double-blind studies. This doesn't mean the connection isn't real. It just means that science is a slow, methodical process. By choosing to address your hip strength, you are essentially acting on the leading edge of practical clinical wisdom. You are choosing to believe in your body's ability to adapt and improve, rather than passively accepting a story of inevitable decline. Let me share a quick, anonymized story that illustrates this perfectly. It's about a gentleman we'll call David, a 62-year-old retired teacher. David used to love hiking in the national parks, but over the past few years, a persistent ache in his right knee had turned his passion into a chore. He'd tried everything: fancy knee braces, expensive gels, you name it. His doctor showed him an x-ray and told him he had moderate arthritis, suggesting he just take it easy. He was frustrated and starting to feel his world shrink. He was skeptical of online advice, but stumbled across the idea of the hip-knee connection. He tried the single-leg stand test and was shocked to see his right knee collapse inward dramatically. It was a revelation. He started with the basics, just like we've discussed: clamshells, glute bridges, and gentle stretches, done with focus and consistency for just 10 minutes every day. The first week, he didn't notice much. The second week, he thought maybe the ache was a little less intense in the mornings. By the end of the first month, he went for a walk on a familiar trail and realized something amazing. He wasn't thinking about his knee. The constant, low-grade throb was gone. It wasn't a miracle cure that happened overnight. It was a gradual, steady improvement built on a new understanding and consistent, targeted effort. David didn't magically reverse his arthritis, but he changed the way his body managed the load, and that made all the difference. He got his freedom back, not by fixing his knee, but by strengthening his hip. So as we wrap up, I want to recap the powerful wins you've gained today. This wasn't just another video about knee pain. This was a fundamental shift in perspective. Your first win is the knowledge that the location of your pain is not always the source of your problem. You now understand the kinetic chain and how a weak hip can directly lead to a painful knee. Your second win is empowerment. You are no longer just a passive victim of your symptoms. You have a 30-second assessment that allows you to be a detective for your own body, to look for clues and understand your unique movement patterns. And your third and most important win is a plan of action. You have 3 simple, safe, and effective exercises that you can begin using to build a stronger support system for your entire lower body. You've learned to challenge the myth of just getting older and replaced it with a story of proactive, intelligent self-care. My hope is that you leave this video feeling not just informed, but genuinely hopeful. Hopeful because you have a new direction to explore, a logical reason for your pain, and a practical first step towards finding relief. Now, I would love to hear from you. Which part of this investigation was the biggest aha moment for you? Was it the kinetic chain explanation, seeing your own movement pattern during the self-assessment? Or was it simply the idea that you're not just stuck with this? Please share your thoughts and experiences in the comments below. Reading them not only helps me, but it creates a community of support for everyone watching. And if you enjoyed this deep dive and want more evidence-based content to help you stay strong, mobile, and independent for years to come, please be sure to hit that subscribe button and ring that little notification bell so you don't miss our next video. Thank you so much for spending this time with me today. Remember that knowledge is power, and consistent action is the key that turns that power into real-world results. Be well, stay empowered, and I'll see you in the next video.